The topic that I researched for this project is the disease of aortic stenosis. Aortic stenosis can be described as a simple plumbing problem. It is when calcifying material builds up inside the aortic valve and leads to the narrowing of the pathway for blood to flow through. When this happens, blood cannot pump efficiently through the heart at the rate it needs to, and as a result, the circulatory system becomes backed up. Without treatment, this disease can lead to chronic congestive heart failure, which has a high mortality rate. The aortic valve is located on the middle left side of the heart. It is placed in between the aorta and the left ventricle. The job of the aortic valve is to allow blood to pass from the left ventricle out to the rest of the body. The aortic valve is also responsible for preventing backflow of the blood. After blood passes through the aortic valve, it travels through either the head vessels of the aorta or over the main aortic arch to the rest of the body. The aortic valve is a semilunar valve with 3 leaflets or cusps that serve as monitors for the blood flow. For this project, I have split the disease up into 3 sections: causes of aortic stenosis, effects of aortic stenosis, and treatments for this disease. A congenital heart defect, buildup of calcium on the valve, or scarring of aortic tissue from rheumatic fever can all result in aortic stenosis. The main focus of my research was on the calcium buildup on the aortic valve, but I will briefly discuss the other factors as well. A congenital heart defect is when someone is born with a valve containing a different number of leaflets than the standard 3. This deformity may not cause any problems until adulthood, but eventually it will lead to a narrow or leaky valve. At this point, the valve must be replaced or repaired. The buildup of calcium on a valve is quite common. Our bloodstreams contain large amounts of calcium, which are deposited on the leaflets of the aortic valve over time. This mineral is readily deposited because of the properties of calcium. Calcium has a positive 2 net charge and is commonly bonded with carbon to form the ionic bond calcium carbonate. This bond is commonly found in prescription drugs, which explains the large supply of calcium in the bloodstream. I think of aortic stenosis as a mixture of sandy water trying to pass through an opening and closing door. The sand represents the calcium, the water represents the blood, and the doorway represents the valve. As the mixture passes through the doorway, the door would close and cause backwards motion of the sand. This event would get the sand lodged behind the opening side of the door as the sand continuously gets pushed back into the wall. This is similar to aortic stenosis, where the calcium in the blood flows through the valve, but becomes trapped behind the valve as the backflow pressure sends the blood against the leaflets. Calcium cannot latch onto the aortic tissue as it passes by. However, the blood flow creates rivets in the aortic tissue that allows calcifying material to settle in. In most cases of AS, the calcified deposits stick directly to the leaflets. Under normal conditions, calcium phosphate deposition doesn't occur, but during disease, changes to the valves occur that favor the deposition of calcification. Calcium phosphate deposition is when the calcium groups in phosphate bonds, such as Ca2+. These bonds allow for the calcium to form to other phosphates and in some cases even hydrogen or hydroxide ions. Other factors that contribute to the formation of calcium on the valve includes the deposition of cholesterol or changes in the extracellular matrix of a valve. An example of this could be the degradation of the proteins collagen or elastin. This change in properties of the valve would allow for calcified deposits to attach. The normal valve's cellular and matrix architecture may be disrupted by exposure to biochemical or mechanical stress. These events result in a progressive thickening and fibrosis of the leaflets, with evidence of inflammation, neovascularization, the appearance of ectopic tissue, and calcification. The factors that lead to aortic stenosis are increased age, the male gender, hypertension, smoking, and hyperlipidemia. Many people in the United States are affected by aortic stenosis. Approximately 1.5 million people have aortic stenosis. Of those 1.5 million, 500,000 people have a severe form of the disease. By severe, I mean greatly limiting everyday activity. An additional 750,000 are unaware they have the disease. Recent estimates indicate that aortic valve disease is common in the United States adult population and contributes to more than 28,000 deaths and 48,000 hospitalizations annually. Also, roughly 75% of aortic stenosis patients are male, while the remaining 25% are female. Some side effects of aortic stenosis include fatigue, angina, exertional dyspnea, and syncope. The survival rate of a patient after these effects or symptoms are noticed is roughly 50% for 2 years and 20% for 5 years. Many people, after detecting these symptoms, pass it off as tiredness and chest pain. However, in most cases, surgical intervention can and will be performed promptly once even minor symptoms are noticed. It is imperative that symptoms are inquired about immediately. There are only 2 forms of treatment for AS, including 2 valve replacements called transcatheter aortic valve replacement and surgical aortic valve replacement. Surgical valve replacement has been the only effective treatment for aortic stenosis since 1960. The only other way to prevent this disease is by taking care of your body and not inheriting the disease in the first place. There are no known medications for slowing the progression of aortic stenosis. A doctor may distribute antibiotics or pills to control blood pressure, but other than that, there are 0 anabolic treatment options. Transcatheter aortic valve replacement is a minimally invasive valve replacement that is FDA approved for high and unacceptable risk aortic stenosis patients. There are 2 different types of transcatheter aortic valves. There is the self-expanding Medtronic core valve, and then the more common balloon-expanding Edwards Sapien valve. Both are in a similar price range, but the balloon expandable valve tends to have more success. In transcatheter aortic valve replacement, once the new valve is expanded, it pushes the old valve out of the way and acts as a new setup for monitoring blood flow. The transcatheter aortic valve replacement procedure is performed by a cardiologist inserting the valve through the femoral artery in the groin or through the tip of the left ventricle with the transcatheal approach. Other approaches, such as transaortic and subclavian, can be used as well. Regardless of the approach that doctors use, the transcatheter aortic valve replacement procedure requires a collapsed valve being inserted by catheter into the aortic valve of the patient, where it is then released and expanded. This procedure is reserved for those whom open heart surgery would be too risky. The transcatheter aortic valve replacement procedure is not all positives. It has some downfalls as well. Each transcatheter aortic valve replacement device costs close to $30,000 in America right now, making this one of the most expensive procedures that is offered. Also, the transcatheter aortic valve replacement leads to an increased chance of stroke and paravalvular leak. Surgical aortic valve replacement is the gold standard for symptomatic aortic stenosis. However, surgical aortic valve replacement may not be for everyone, as it requires open heart surgery. The surgical aortic valve replacement procedure is performed by a surgeon creating a 6 to 8 inch incision down the front of a person's torso. Then, as their blood is circulated through a machine, the surgeon will reach the heart and create a careful incision upon where they would like to insert the new valve. This valve will then be placed in between the aorta and the left ventricle. Finally, the doctor will stitch up the body and inform the patient to be careful and easy on their heart for the next few months. The surgical aortic valve replacement procedure is most common because it offers a decreased chance of stroke, and the cost is much less. However, the surgical aortic valve replacement method may not be for everyone because of the risky nature of the open heart surgery associated with it.